Welcome to Startup Health TV, I'm Logan Plaster. My guest on today's Health Moonshot Update is Tatyana Kanzaveli, the CEO and founder of Open Health Network, which joined Startup Health in 2016. This startup was designed to really help hospitals and other institutions rapidly deploy new health technologies. The name of the game was speed and interoperability. When COVID struck, Tatyana and her team put their own tool to the test and rapidly created one of the first COVID symptom trackers on the market in just a matter of days. Now they're turning their attention from individual tech implementations to creating a health tech infrastructure that really carries patients from their first encounter with a provider all the way to the in-home care setting. It's called Constant Care, and Tatyana breaks it all down for me in our interview. Stick around.
Great.
All right, welcome Tatyana Kanzaveli, CEO and founder of Open Health Network. It is great to have you on Startup Health TV. Thank you for taking the time.
I am glad to be here.
So Tatyana, we talked not too long ago in normal human months, but in the course of 2020 and COVID-19, feels like many years ago. I believe it was in March or April of 2020, we talked just as the West Coast was locking down. Here in Baltimore, we were locking down, and you were really looking at how to reframe what Open Health Network was doing, how to take what you'd built and address the COVID landscape. And so maybe just to start, just kind of catch me up. At that point, you were describing how you built over the course of 2 days a COVID tracker, and you had just launched it. So kind of give me a little catch up over the last 10, 12 months as to how that fleshed out.
COVID tracker, it was done, rapidly. Literally, we were the first ones to release symptoms tracker in 6 languages, like Swahili, Spanish, English, French, Russian, Chinese, and surprisingly enough, I just checked recently, it's still used by tens of thousands of people. So apparently it's all good. And but what we did within this time frame, we released, it's like a new company, to be honest with you, and I'm still debating whether to launch it as a company or for right now it's a product, Constant Care. And it's so powerful, and it has been already deployed in clinical research and prevention for a variety of complex diseases and chronic disease management. But it's
How is it a new product? So my understanding of Open Health Network and the initial offering was that it was the infrastructure. It allowed organizations to rapidly develop, spin up technology across a range of diseases and challenges. So really kind of the brains behind a tech rollout. Is that correct?
yeah, and that's gone.
And that's gone.
That's gone.
That's gone. Okay. Okay.
That's gone. That's why it's a completely new company that we just, relaunched, if you will. So Constant Care is a complete integrated framework for chronic and complex disease management. And it's not disease specific, but it enables on physician and care team. So you can dynamically create a care team that can include physicians, specialists, social workers, family members. It's dynamic. So care coordinator can, put those people in as a part of the team based on who they are. They have security, what they cannot see, do, and so on. Now, each of those people can create templates of, based on pathways or whatever care plans. And all of that gets integrated and communicated real time to a patient. And I'll give you more examples, but it's super fascinating because within a care plan and all the specialists, you can include 100% of things you want people to do once in a while on a regular basis. And it's pretty broad and very detailed. So you can include, obviously, medications and things that you see, okay, exercise or diet and surveys, assessments, educational materials, everything adaptive, personalized, but we take it to the next level, meaning that you can, especially now with COVID, where you have to provide remote patient monitoring and complex disease management without people coming to you, you can be very detailed, like put your Fitbit on, get on a stationary bike, here's your target heart rate, here's how long you need to be in that one. And so it can be very specific, but the beauty is you can get complete care, collaborative care across all the conditions that people can have in one space that gets real-time, integrated, personalized with the person, and then with any sensor and device. We have hundreds of toys and gadgets that we integrated with. We've done, people just super pleased that they can do this complex care management in this environment where we give access to the management panel, where care coordinators can rapidly, literally drag and drop of everything, and pathways can be dropped in real-time integration. You can see on your device what you need to do for the day. If it involves gadgets, you can receive a training material on how and what to attach where. As soon as you do those things, your care team sees real-time data if you do or don't do things, and it gets AI and triaged.
It sounds
So
like it's we have technologies in care coordination and in patient engagement, and then on the clinician side, that decision support. It sounds like what you're describing is kind of piecing all of that together. I mean, hence the name Constant Care, tying it together with one fabric of technology. So from the physician, and you can correct me if I'm wrong, but from the EHR side to the care coordination side to the outpatient to the patient engagement, like you said, getting on an exercise bike, all of that connecting tissue pulled together. Is that right?
Yeah, so yes, exactly. Our core belief was that if you tell people with, complex diseases, and especially if they have multiple comorbidities, or here's an app where, you answer survey questions, and now use another one for educational content, and here's something else for your diet and behavioral health. And I mean, if it's not personalized, adaptive, and dynamic, because in most of the cases, based on your data, you need to engage different specialists and so on. So we enable all of that, and it's very intuitive. It has been deployed in cardiology, in GI, behavioral health, wellness, autism, Alzheimer's. So all those, we're working cancer, addictions.
What
So
was it
we're
about?
very proud.
What was it about Constant Care and Open Health Network that allowed you to develop something? I mean, this is going back to your original mission, but develop something so broad, so rapidly. Because what I'm hearing you saying, you're describing pulling together multiple types of offerings that other companies have spent a long time developing. And here you sort of pulled it together, multiple specialties, multiple use cases, and that was a pretty rapid development. So how are you able to do that?
Like if you look at the history, we've practically, pivoted number of times from when we started. And the offering that we had before this enabled us, it was a tool for developers.
Mm-hmm.
Now, And it was highly successful because we were able to develop things for our clients that was white labeled and productized rapidly, very smart, like all those things. But what we've learned by doing that, we've learned exactly what is needed on clinical research and prevention. We use know-how. Granted, we've been working across many disease areas with large healthcare organizations. We've learned a lot. We listened to everything, and with everything that we had in underlying framework, we were able to build this super exciting, and I would say extremely useful thing that people love. Like uh, I always ask, our clients to get feedback from, patients. When we have pediatric, we have older people, we have, variety of different diseases, and they love it. Even the people who have been engaged, for example, in research, they ask to use it beyond, the research terms. And I'm super excited that we deployed it in clinical, in research, and in prevention.
Okay. So the physicians are using it, are interfacing with it as they look at the EHR. They are deploying it as they send the patient home, and the patient is using it for themselves. So like these very different settings. Is that kind of what you're describing?
Right. So we've been working with researchers for a long time. So if there are some research projects, and we're part of gazillions of NIH granted projects with UCSF and YU anyway. So we know that part real well, and we know how to work with them. Usually it's multi-year research, and um, that's good on the clinical side, especially with COVID. So you have let's say people with cardiovascular issues, and they don't want to come in, so you need to basically enable remote patient monitoring in some cases very prescriptive, right? In terms of monitoring everything that they do at home. Like we practically enabled complete cardio rehab at home, deployed, that includes even all the measurements you can take, but it's beyond that because we deploy machine learning and AI on front end and back end, everyone between where it makes sense. We're working with clinicians, so everything gets adaptive and personalized, and it literally includes behavioral aspects of disease management along with disease management. And people, clinicians just happy that they can support the most, people with most difficult, like, complex diseases in this virtual, environment that we unfortunately all are. And the beautiful thing is that we kind of integrate communication channels as well. So within our framework, like if we see certain data points that warrant telehealth visit, you can schedule that. You can, and it automatically, you don't need to go to another place to set up your telehealth. It can be invoked. We also can schedule chatbots, and we do. And everything that's happening. So the beautiful thing is, as you do those things, survey, do something. We capture data from Apple Health, Google Health, Fitbits, different sensors that we have, all of them for sleep, for oxygen, weight, anything. All of that real time at the heartbeat level is available to a care team with triage function. You see what I mean, right?
Yeah, got it. So you are rolling this out rapidly. It's got a really great breadth of potential impact. I know you've tested and adopted with Mount Sinai, Cleveland Clinic, New York University, and Children's Hospital of Philadelphia. That's what I have on my list. What are you looking forward to next in 2021? Where are you scaling this?
Oh my gosh! So we are like super excited. We're working with, I don't want to name names, but with the largest healthcare organizations that everyone looks at as the most innovative, uh, uh, in terms of digital health offering. So I'm super excited, and we will be doing more in cancer and in autism. We you will see that in Alzheimer's with Colombia, and we we're constantly adding more features that we see you know people need. And our next area, I would say, more, so we've been working with providers, researchers, clinicians, and on prevention specialists, behavioral health, all those people. But I think there are a lot of opportunities to do more with payers and pharma,
Sure.
because they're getting into all of that. And so far it was them pushing niche stuff. You go and they're like laundry list of different things that they ask people to do on different different apps and so on.
Yeah.
So we can see that we actually can bring a lot of difference to in those areas as well. But I mean, right now, I can tell you we've been over busy, and we're happy that we can help.
Yeah.
We did everything from conversion, something that was supposed to be face to face, to completely online, and expanding what was supposed to be online for one disease across many diseases. And once it gets deployed in one department within healthcare organizations, other people want to use it for other diseases. So
I've got a wild card question for you. I understand that you are a master chess player. And I was thinking about our last conversation and thinking about kind of responding to the attack of COVID, how you kind of rapidly came back with your sort of first um, COVID tracker response. And then how since then you stepped back and you had this more big picture measured attack back. And I imagine that once you're sort of a chess master, you can't help but sort of think in these sort of strategic terms. And I wonder, like, where you feel like, if you were to use some of that as an analogy, kind of where you feel like we're at right now in terms of developing um, our response and our really kind of like a counterattack to COVID, and kind of what we're building now with telemedicine. Maybe that's a little bit of a strange question.
um, yeah, like I feel like we always tend to do, move like to extremes, right? So we have COVID, and suddenly we all feel that telehealth is the only way to do things. In reality, that's never the case, and things will normalize, and normalizing a little bit more. So I strongly believe that this extreme where everything is telehealth and remote health will also will normalize. And so we came from one extreme where anything you have to go and see the physician, and to extreme everything online, and virtual and so on. The truth is somewhere in the middle. And my kind of vision is to understand and help providers, pharma, researchers, and patients to intuitively enable any communication channel with constant data flow, because when you have those gaps in data flow, and usually, it happens, especially if there are like complex diseases, rare diseases, chronic diseases. There are just too many people involved, too many phone calls. Oh, I prescribe this, now you have that, now I need to talk to that. And whether it's in person, online to come in. So all that will be normalized, where as you know, I'm strong believer in capabilities of AI to help, not to replace anyone, but to help with certain decision-making processes in care coordination. So we deeply like kind of deploying all those where it makes sense. And with our offering on the data exchange, all that becomes kind of easy to figure out, what channel probably will make more sense, and what if people come in, what's happening when they go back home, what needs to happen. This, I mean, fundamental issue with our healthcare model before was that you basically operate from disaster to disaster, right? You come in, you don't feel well, you get sent home, you potentially, no one knows what's happening to you in between. Like I had my cancer surgery, right? So I was, sent home, and I was asked to come like 7 days after discharge, right? No one knew what was happening to me within those 7 days. The next follow-up was in 6 months, and I'll get 5 pages of surveys. And this is like, so I'm glad that certain process improvements are made to kind of remove all those deficiencies, and the end result will be better care. And that's what we all want, right?
Well, exciting developments, Tatyana. We're going to have you back for a whole episode just on blockchain and AI in healthcare and kind of where your head's at with that. But I think that's enough for today to sort of let people know about Constant Care, what you've built, kind of where it's going in 2021. Final question: if someone wants to learn more or potentially partner with you, what are the best ways to learn more and reach out?
So the easiest, it's email contact@openhealth.cc. And I am so confident in our capabilities that I'm telling you, if you have, providers, payers, any, complex disease, we can, from getting the requirements to, deployment within our framework, Constant Care could be done in 1-2 weeks.
Wow.
So yeah.
In 1 to 2 weeks. So
yes.
it sounds to me like the huge proposition here is the capabilities, the tech capabilities to scale up quickly, to understand a breadth of specialties, a breadth of workflows, just the ability to apply what you've built in kind of whatever challenging way your customer needs. Is that right?
Yeah. And from my point of view, it's needed now. It will be, and we build our, disease management, care coordination in a way that it can be deployed in 1-2 weeks.
Fantastic. All right, Tatyana, I wish you the best. I thank you for taking the time for getting us up to speed, and look forward to checking in and hearing about Constant Care in the months to come.
Thank you. Have a good day.
All right. Be well.
Here. Bye.